Welcome back, everybody, to OET Prep Talks with me, Milen Jacob. Today, we are going to look at an important aspect of OET preparation, which will help you to excel in both speaking and writing. And that is the use of lay language and avoiding medical terms or technical jargon. But before we go into it, let's look at what OET says about this aspect. I'm going to read something from the speaking criterion of appropriateness in language. It says entirely appropriate register, tone and lexis for the context. No difficulty at all in explaining technical matters in lay terms. So that's what we are going to look at. How can you explain technical terms in lay terms? Now, if you look at the writing criteria, when you come to genre and style, it says writing is clinical, factual and appropriate to genre and reader. Technical language, abbreviations and polite language are used appropriately for document and recipient. So there may be instances when a lot of technical language might not be understood by the reader, even in writing. So depending on to whom you are writing, you may have to change to lay language. And for health professionals, for a lot of health professionals, this is a difficult task because you are so used to technical terms or medical vocabulary or jargon that it becomes part of you. You are not used to explaining things in lay language. When it comes to OET, this could be a difficulty. So let's see how you can, use more of lay language or simple language while explaining medical terms. Now, I've got a few medical terms, mostly conditions, for you to work on it, all right? So let's start with a simple condition. Let's take hypertension. How will you explain hypertension in simple words? If you can think of something, you can also type in the chat box so that it will give you some practice. All right. So maybe you can explain hypertension as high blood pressure in the arteries. Now think of MI, myocardial infarction. If you want to type, you can type in, or just think what will you explain to a patient, or if you're writing to somebody. Now, nurses and doctors do not have to write to carers or lay people, so you may not require as much as some other professionals, but still if you're writing, let's say, to a social worker, the social worker might not know all the technical terms, so still you may have to learn how to use lay language, even when you're writing to other health professionals who may not have the kind of medical knowledge as you might. All right, so you may, say something like, the common term is heart attack, of course, but if you want to further explain, like in speaking, you can say like, it occurs when the blood flow is compromised or reduced to parts of the heart, causing damage to heart muscles. Now let's think of another term, angina. How will you describe angina? Yeah, give it a try. So you can say it's a chest pain or chest pain caused by reduced blood flow to the heart. Okay, great. Now let's look at some more conditions or other terms. Okay, I've got thrombocytopenia. Can you think of how you will explain thrombocytopenia? So you can say something like when a patient has low blood platelet count or low levels of WBC, this is something that is called thrombocytopenia. All right. How about arrhythmia? You want to explain arrhythmia to somebody, how will you do that? Go ahead. So when somebody's heart is not beating in a normal rhythm, you can tell that This is what arrhythmia is, right? Think of lumbago. What is lumbago? Or you see a roll card which says you are seeing a patient who has come in with or has been diagnosed with lumbago. Lower back pain, yes, especially one which affects the muscles and joints of the lower back. There you go. Eczema, of course, it's very common, and you get role plays with a lot of dermatological conditions. So how will you explain eczema to somebody? You can have, this is a condition when the skin becomes itchy or red or dry and cracked, and so that is something which you can try converting to lay language. All right. Now let's go to bronchitis. How will you explain bronchitis? Yeah, it's an infection of the airway, the main airway of the lungs, or bronchi, which makes it inflamed. Yes, very good. Now let's go back to something more simple, like a migraine. How do you explain what a migraine is? You can say it's a kind of headache, sometimes moderate but sometimes severe, and affects a part of the, or one side of the head, right? Can you think of, now I've got another term which we often use, contraindicated. How will you explain if a drug is contraindicated? How will you bring it in lay language or simple language? Think of it. So maybe you can tell somebody like, there are several reasons why this drug cannot be administered to you, and so that is why it is written or it is mentioned that this is contraindicated, especially when multiple drugs or therapies are done together. Right. So I hope you have learned how to use simple language instead of technical terms or jargon, and this will help you to speak more, because instead of one word you are saying something longer, and then it shows that you are able to convert technical terms into simple language and show that you know how to use appropriate lexis and the register which is suitable for the context. So happy learning, and I wish you great success with your OET preparation. See you on the other side with another prep talk. Thank you.